I specialize in neurosurgery, and my particular subspecialty is specializing in peripheral nerve surgery. Some patients come to me because they've had a nerve injury, so they might develop weakness in one of their limbs. A lot of patients come to me because they're having pain, and that's primarily due to a problem with their nerves, and so they're looking for solutions that can occur because of that. I also see patients that have tumors, so tumors that typically arise from the nerves throughout their body, and that can happen anywhere. We're really looking to see what's the best solution for them to get them more function back. So medications, therapy, sometimes we do injections to the nerves to help improve the pain. And then obviously if those fail or they have a surgical problem, then we start approaching surgery. So really it's sitting down with the patient trying to make that decision about where are they and what kind of solutions do they want. Walking the patient through the various different surgical options that can range anywhere from, if it's a tumor, helping them take out the tumor if that's necessary, from if a patient comes to me with a nerve injury, at that point in time, we can talk about the different solutions for that, whether that be going in and reconnecting the nerves to hopefully help them improve their function, or is that sort of stealing a working nerve and plugging it into the nerve that's not working, or more of a nerve transfer procedure. For patients that have really complex problems, I enjoy working with a multi-specialty team that helps improve their pain, but also a surgical team that helps them get their function back through various different means, either through nerves or tendon transfers, muscle transfers, things like that that can, again, get the patient back as functional as possible. I also run a basic science lab, so I get to take the questions that we see in the clinic and take them back to our lab to try to figure out, how do we solve some of these problems? How do we make nerve injury better? How do we treat tumors better? How do we do different things that we just don't have the answers to yet, which makes, I think, my job the most fun. I really like football, so college football is a big passion, so we spend a lot of time, and the Iowa Hawkeyes going to games.